poverty is one way that I say categorically is a very big source of post-traumatic stress disorder. And that is why you find in poor neighborhoods, you have more mental health issues than you have where people have money. Because where you have money, you can feed well. Where you have money, you can pay your school fees. You can pay for your rent. But where you have no money, then you have other issues that on top of what maybe you could be going through, we talk about psychosocial support. Every constituency should actually have their own community counseling center. Why am I saying that? For any ordinary Kenyan citizen to receive the services of a psychologist or a counseling psychologist or clinical psychologist or a psychologist in this country, you don't pay less than 4,000 an hour. That could be a salary of an individual working in somebody's place as a house help or a gardener. But does that mean that mental health only happens to the poor, to the rich? It's to everybody. And right now, because everybody has a right to receive mental health services, has a right to access mental health services, which way forward? And we have said 1 out of 5 patients seeing a doctor are suffering from one mental health condition or another. 1 out of 4 that are hospitalized, admitted in hospitals, have one or more mental health conditions. We have seen the numbers rise of the number of people that are abusing alcohol and substance abuse in this nation. We have seen more deaths, suicide cases, homicide cases than we have ever seen before. Are we going to watch by not just doing one? I want to say simple, because sometimes it calls for a lot of money to build a hospital and equip it. But for a community counseling center, you just need a designated piece of land, and we need a structure that just comes up and just a few rooms there for different services within a community counseling center. That is not too hard to ask. It just needs goodwill. It just needs a directive. Are you there as a government official to direct that for the sake of the people that give you the vote, for the sake of the nation, and for the sake of the world, peace and compassion? But if we cannot even devolve health services, especially mental health services, to the grassroots level, then we are still having a very huge gap. For once, I want to appeal to the government. With AIE, you have the authority to incur expenditure. Whether you are a member of county government, where you are a member of parliament, whether you are the women's rep, whether you are the governor, whether you are that ward representative or ward admin, that you can give money to actually build a community counseling center, and you care about the mental health burden this country of Kenya, to begin with, is experiencing right now. We have seen enough cases. We have seen people die under our watch. We have seen people jump onto the road to have them ran over by vehicles. We have seen people jump off storied houses. We have seen people kill one another. We have seen atrocities against humanity happening in this country. But today we are not here to blame one another. We are here to appeal to you, who has the authority to incur expenditure. You have a budget. How do you reduce violence in the community? How do you empower the youths to take care of themselves, to empower themselves? How can they reduce depression in the community? How can they reduce trauma in the community? How can the police, the village elders, the chief, everybody work as one family? And the World Health Organization has given this directive very well. They have talked about the pyramid of mental health. We do have the psychiatrist at the pinnacle, but at the grassroots level, we have the community counselors. How empowered are they? These community counselors are volunteers, and they may not even be asking for a salary, but they are asking you, can you make my work easier? Does it mean it's not possible? It is possible. And what is the beauty of having a community counseling center? You can have everything that the community needs in that center. You can have a rescue house there. You can have the education house there. And more so, whatever they are doing, instead of referring, like the teenage mothers they work with, the youths that they work with, to come for services all the way to Thika town, they can have those services within the community.